Welcome! Thank you for joining us in the Department of Drug and Alcohol Programs video on resources and support systems for substance use disorders. We understand that supporting a loved one with substance use disorder, often referred to as SUD, can be challenging, feel overwhelming, and can often be confusing. Know that you are not alone in this journey and that there are supports that can help you. This video will provide you with essential knowledge and tools to navigate the landscape of resources, agencies, and community organizations that are available to assist you and your loved ones. Wherever your loved one is in their substance use, whether they are not ready for change or actively working on their recovery, this information will empower you to help and, just as importantly, to take care of yourself as well. At the end of the video, please complete the post-learning check-in found on the Family Learning Series webpage. This brief check-in will provide feedback to DDAP on the usefulness of this video and offers the opportunity for suggestions on future learning to possibly be developed. Throughout this training, we will discuss the role of county drug and alcohol agencies in Pennsylvania, explaining how these entities manage and coordinate drug and alcohol services at the county level, including case management, intervention assistance, and treatment services. Utilizing Atlas and the Get Help Now hotline, we'll guide you on how to effectively use these resources to find services. Case management. We'll explain what this free service is and why it's a vital component in drug and alcohol treatment. You'll learn how case managers can be your allies in coordinating care and accessing resources. Overdose reversal medications. We'll provide crucial information about naloxone, also known as Narcan, a life-saving medication that can reverse opioid overdoses, as well as medications used to treat opioid use disorder and alcohol use disorder. Client rights and confidentiality. You'll gain an understanding of the basic rights of individuals in treatment, including important information about confidentiality laws. Our goal is to empower you with knowledge, connect you with resources, and help you build a strong support network. Remember, you're not alone in this journey. By the end of this training, you'll be better equipped to support your loved one while also taking care of yourself. The process of finding accessible and quality treatment is crucial when an individual is ready to begin treatment. Where to begin? We will talk about some ways to do so, including county drug and alcohol agencies, Get Help Now, and Atlas. First, we will discuss county drug and alcohol agencies, also called Single County Authorities or SCAs. The Department of Drug and Alcohol Programs works with county drug and alcohol agencies for oversight of prevention, intervention, treatment, and treatment-related services. The county drug and alcohol agencies can help with treatment funding for residents who are uninsured or underinsured, assess the need for treatment and other services, and make referrals. Your local drug and alcohol agency can help with applying and receiving medical assistance benefits in order to provide assistance with treatment needs and services. The drug and alcohol agency must be in contact with the individual who is in need of treatment and services. The first step is finding your local county drug and alcohol agency. You can find your local county drug and alcohol agency on DDAP's website under County Drug and Alcohol Offices. Another resource that is available if you or someone you love is seeking support is Pennsylvania's Get Help Now hotline. It is here for you anytime, day, or night. Compassionate and trained professionals are available 24 hours a day, 365 days a year to guide you toward the treatment and resources you need. Whether you prefer to call, text, or chat, reaching out is simple. You can call 1-800-662-4357. You can also text a live professional at 717-216-0905 or chat at PA Get Help Now Chat, found on DDAP's website under Substance Use Disorder Treatment. You're not alone. Help is just a call, text, or click away. Let us support you on the path to healing. Get Help Now can provide a range of services and resources to support substance use treatment and recovery, as well as families and loved ones. Information is available on how to access funding for treatment services, sign up for insurance, find peer support services such as meetings, access harm reduction resources such as naloxone, and more. The final resource we are going to discuss to help you find accessible and quality treatment is Atlas. Atlas is a search tool to find and compare treatment facilities. Website users can use the filter option to choose treatment facilities by location, insurance and alternate payment methods, types of treatments offered, and other filters. Atlas also offers a self-evaluation tool to provide insight into what treatment services might be a good fit for that individual. We are glad that Pennsylvania makes available a variety of treatment options for our residents. However, it can be confusing to know what treatment facility is best for you or your loved one. Atlas offers a starting point for your search and provides the contact information for each facility so you can further learn about each facility to determine the best fit. Now that we have discussed available resources to help you start on the treatment and recovery journey, we're going to explore a different type of resource: naloxone. Naloxone, also known as Narcan, is a medication that can save lives by reversing an opioid overdose. It works quickly to restore breathing when someone's breathing has slowed or stopped due to opioids. This includes prescription painkillers or drugs, such as fentanyl or heroin. It's simple to use and safe for everyone, including older adults, with no risk of addiction or misuse. Having naloxone available can make a big difference. Studies show that access to naloxone reduces the chances of a fatal overdose by 30% in the year following a non-fatal overdose. It's a good idea to keep naloxone on hand if you or someone you care about uses opioids, whether prescribed or otherwise. Naloxone is easy to get. Many pharmacies have naloxone available through a standing order, meaning you don't need a personal prescription. Medical assistance covers the cost, and most commercial insurance plans may also cover it. Check with yours to confirm. You can also access free naloxone, fentanyl test strips, and xylazine test strips in your community. Visit Pennsylvania's Overdose Prevention Program website or request naloxone by mail through Next Distro. If you'd like to learn more about how naloxone works or how to use it, there are resources and trainings available. Remember, carrying naloxone is a simple way to protect yourself and those around you. It's never too late to be prepared. Always call 911 before administering naloxone. Emergency responders can ensure their safety and provide follow-up care. You can find more information on naloxone under the overdose section of the DDAP website. Now, we will explore some of the formal support services that you might encounter in treatment. We will explore case management, counselor, and peer support services. Case managers are a central point of contact. They connect your loved one with appropriate services and follow them throughout the different stages of treatment. In the beginning, case managers will work to explore needs and develop a collaborative plan to address those specific needs. Case managers collaborate with all the providers who are involved. A case manager will be able to connect with appropriate services, advocate for their needs, and follow them throughout treatment continuum. Case management services are free and can be requested at any point, whether the individual seeking help is just beginning or has been in treatment for some time. If you're interested in learning more about case management services, please reach out to your local county drug and alcohol agency. Counselors provide therapy focused on addressing drug and alcohol use. They also help with the development of skills to manage triggers and cravings effectively. It could be a combination of individual therapy and group therapy sessions. Peer support specialists are individuals who offer support and guidance with treatment, based on their own experience with drug and alcohol use. Your local drug and alcohol agency can assist in connecting you with free peer support. Family peer support specialists are individuals with personal experiences caring for a loved one in drug and alcohol treatment. They have specialized training and help families access and navigate services and support. Dealing with someone's drug and alcohol concerns can feel isolating. Just know that you are not alone. Getting help from people who have had similar experiences can make a world of a difference. These resources provide valuable assistance, guidance, and community connections. 12-step programs such as Al-Anon family groups and Nar-Anon family groups provide support for families and friends of individuals struggling with drug and alcohol use. Meetings can be found on their official websites and may offer both local and virtual meeting options. Some other program options include Smart Recovery, which is an alternative to a 12-step program. Grasp Grief Recovery After Substance Passing, which provides support for those who have lost a loved one to drug and alcohol use. And Learn to Cope, which is a peer-led support group for families. As a family member, you and your loved ones deserve to be treated with kindness, dignity, and respect at every step of your journey. An individual's care should reflect their needs, values, and voice. Here's what can be expected. Respectful, evidence-based care. Treatment will always be grounded in proven, compassionate practices tailored to an individual's unique story. Their voice matters. An individual has the right to help shape their treatment plan, ask questions, or decline a treatment that doesn't feel right. If something doesn't sit well, they can always file a complaint. Their concerns will be heard. Remember, an individual is in control of their care. Their privacy is protected. Their voice is valued, and we're here to help and assist in finding the appropriate supports and services. The last resource we are going to discuss is medication-assisted treatment. Medication-assisted treatment includes methadone, buprenorphine, and naltrexone. These medications work by reducing cravings and withdrawal symptoms. These medications have been shown to improve treatment outcomes and to help restore balance and safety. There is often a misconception that one substance is being replaced for another. Medication-assisted treatment involves treating a medical condition with safe and effective medications. Remember, you're not alone in this journey. The resources and support systems we've discussed are here to help both you and your loved one. Don't hesitate to reach out for help when you need it, whether it's through support groups, hotlines, or professional services. Treatment looks different for everyone. What works for one person might not for another, and that's okay. Reach out whenever you need guidance, whether it's finding medication-assisted treatment providers, joining a support group, or simply asking questions. Help is always here, without judgment. Healing takes courage, and every step forward matters. You deserve care that honors your strength and humanity. Thank you for watching DDAP's Resources and Support Systems for Substance Use Disorders video. Please complete our quick post-learning check-in so we know how beneficial this was for you, and to offer any suggestions you may have for other videos you would like to see. Don't forget, you are not alone.